Hi, I'm Dr. Winnie King, and I want to speak with you about hormone deficiency. This is a sad reality of life for most all of us. By the time you turn 30, your hormone levels will slowly start to decline. And when you're in your late 40s, into your 50s, and certainly in your 60s, your hormone levels have dropped. That's normal, nothing to be ashamed of. But the symptoms can be extremely uncomfortable. For women, they can experience mood swings, hot flashes, irritability, difficulty sleeping, low sex drive, memory fog, sort of forgetting why you walked into a room. Does that sound familiar? All of those things can be signs of hormone deficiency. For guys, it could just be that they are irritable, they don't sleep well, they have low sex drive, they're noticing they're getting a little fat around the gut, and they also can have memory fog and just not feeling themselves. With guys, you can experience things very similar. You can have the irritability, the mood swings, not sleeping well at night, low sex drive. All of these can be signs of you developing hormone deficiency. And when this happens, it happens gradually. I think if something happened yesterday and today, it would be obvious that something is wrong and you would jump right to the doctor to get something done. But when it starts in your 30s, and you start to notice, I'm not quite myself, things are a little bit different, but you just keep on going. And then you're in your 40s, again, I guess this is what old age is all about, and you just sort of keep on going. And by the time you're in your late 40s and into your 50s, you're not feeling great. And you're sort of feeling like this is just the way life is, and you don't know that this is something that can be treated and corrected. It's not a disease, this is normal. But these days, we have treatments that can really turn back the clock and do it in a way that's safe and actually extends your life, helps you live a better quality of life. And that's bioidentical hormone replacement. Now, I say bioidentical because that word sounds scary and big, but it's really very straightforward. It means that it's biologically identical to the hormones that your body used to make. Men and women both have estrogen and testosterone. We just have them in different amounts. Women have much more estrogen and less testosterone. Men have much more testosterone and less estrogen. But yes, guys have estrogen too. It's normal, they need it. But when these levels start to decline, that's when you start experiencing the symptoms that we all know all too well. And often it really interferes with relationships because you don't want to be intimate, you don't feel well, you're irritable, you may pop off at the slightest irritation. You might have problems with your memory where you just cannot keep things in your head. You just feel like you're maybe going crazy at times. I've had a lot of patients come to me with these symptoms, and their doctors have put them on antidepressant medications and anti-anxiety medicines because having this feeling makes you feel anxious. You feel like something is terribly wrong. And sometimes if doctors are not aware of these being signs of hormone deficiency, they actually treat you symptomatically with pharmaceuticals. But the reality is that you don't have a deficiency of anti-anxiety drugs or antidepressants. That's not what's wrong. Your body is changing hormonally, and we can go back and we can recreate a scenario where those hormone levels were higher. We use bioidentical because that means that the hormones look just like the hormones your body used to make. So they're not going to cause you any trouble. There's no risk of you having a foreign object in your body that's going to cause side effects. Typically, there's no side effects when something is bioidentical. The same cannot be said for things that are synthetic. They often will give you results. They're not exactly like the hormones that your body used to make, so you potentially can experience some side effects. So we don't deal with anything that's synthetic, something that's made in a lab. We use things that are made that look just like the hormones your body made. And that's whether it's estrogen or estradiol or it's testosterone. The whole procedure is very straightforward. You just come into the office and we draw your blood, because I need to know where your hormone levels are. And we're going to measure a whole lot of things. So we're going to measure your sex hormones, we're going to measure your thyroid hormones, your vitamin D, your B12, your blood chemistry, CBC, all of the things that I need to know to get a really good picture of what's going on inside. And then from there, I can show you those numbers, and they really do speak for themselves. Back gosh, maybe 7 years ago when I had my hormones measured. They couldn't even measure my testosterone level, it was so low. And I had no idea. I knew I didn't feel all that great. Back then I was working in the emergency room, working long hours, and I was miserable. I thought it was because of that, and it might have been, but it was also because my hormone levels were so low. And once those levels were brought back up with hormone pellets, I felt so much better. It was just like a light switch came back on. And since then, I have been so delighted to give that same gift to my patients as they come through my office. And it's just amazing how much better they feel. They're just so grateful, and I'm grateful to be the practitioner to give them their lives back. It's helped save marriages, it's helped save relationships, because when you're feeling lousy and you're irritable and fussy, it's hard to be around. But I've literally had patients call me up and tell me that they feel like new people. I've even had family members call up and say, oh my gosh, Daddy is a new man. Thank you, thank you, thank you. So, as I said, the first step is your blood work, because we need to know where your levels are. And showing you those usually really helps to crystallize it for you, so you understand why you feel the way that you do. From there, I'm able to calculate a dose of what is appropriate for you. And what we're going to use are hormones that are made by a specialized compounding pharmacy. They're really teeny. This is a little bottle that they come in. Each of them are about the size of a grain of rice. They fit right in your palm. They're teeny, teeny, teeny. And what we do when it's time to insert these pellets, we typically do it in your backside, in your hip area, or in your lower back. And we clean the area off, numb it up with a little lidocaine. That's really the only part that stings, because if you've ever gone to the dentist and gotten Novocaine, it burns when it goes in for just a minute. But then after that, you feel nothing. And then I make a teeny tiny incision with a scalpel in your back area or in your buttock. And then I slide a little tube in and then drop the pellets in the tube and then pull the tube out, put a bandage on you, and send you on your way. It's just that simple. Typically, it takes less than 5 minutes. And for something that's so simple and so quick, it's amazing how much of a difference it's going to make in the quality of your life. So this is what bioidentical hormone replacement is all about, and it's life-changing. It makes such a big difference. Now, with women, we will give you testosterone and or estradiol. If you're still having your cycles, then you don't need the estrogen just yet. Down the road, you will, but you're just going to be getting testosterone. For guys, we only give you testosterone. We never give you estrogen. And, it's just amazing how after about a week, folks feel like completely different people. They're happier, the joy in their life, their interest in sex is totally different. And I've had many spouses saying, whoa, my goodness, my wife is chasing me around the bedroom now, whereas I used to be chasing her. So that's the really great news. Now, from a medical standpoint and as a physician, I'm excited about the fact that beyond the increase in your sex drive, the increase in your mood and your clarity of thought, it also helps you internally, because we know that bioidentical hormone replacement reduces your risk for developing Alzheimer's disease. And if any of you have a family history of Alzheimer's, you know how devastating that can be. And anything that can help prevent Alzheimer's is always going to be a positive. So simply by getting bioidentical hormones, you're going to be reducing your risk for developing Alzheimer's. Something else. We know that bioidentical hormone replacement helps to strengthen the bones, and so your risk for developing osteoporosis also goes down. This is just a plus, just a gimme, just from having the hormones. This has all been quantified and confirmed with studies that show that Alzheimer's risk goes down, as well as the risk for developing osteoporosis. And if these are things that run in your family, that's an additional bonus. Now, I know that a lot of people have heard about hormones and cancer. It's going to cause cancer. Bioidentical hormones are not going to cause you cancer. However, people who've even had breast cancer, and I've had patients who've had breast cancer, they are also able to get bioidentical hormones. We give them a special hormone that doesn't convert to estrogen. It just pretty much stays testosterone, so that your risk for developing cancer is not there. This is a fabulous treatment, and research is being done now in the field of PTSD, post-traumatic stress disorder, that people that struggle with this, particularly our veterans who've suffered so much, and many of them are struggling with PTSD, that hormone replacement actually helps them with that as well. There's really no particular downside to this. The only thing is up. And it's a good thing, it's safe, it's effective. With women, when they get hormone replacement, it typically will last them for about 4 months. Some even sooner than that. With women, when they get bioidentical hormone replacement, it will typically last them for about 4 months. Some women might need it every 3 months because they love the way they feel and they don't want that feeling to wear off, but anywhere from 3 to 4 months. For guys who are getting just large doses of testosterone, because they get so much more than women do, their hormones will last them up to 6 months. So they're really looking at just coming in just twice a year to get their hormone replacement. And the quality, the benefits are really, really amazing. There's really no reason not to try it, and I think that you're going to find that you love it. It will change you, and you're going to be surprised when you mention hormone replacement among your friends, how many of them are already getting it. That's what my patients often tell me. You know, I told my girlfriend about it, and she's like, oh girl, I've been getting those hormones for years. And you're like, what? You never told me about it. And it's like, yeah, I know, I didn't want to say anything, but yeah, I've been getting it. My husband too. That's why we're always smiling. So we want you to have the smiling in your life as well, and the great sex, the great energy, the great sleep, all of the things that you deserve and can be taken away from you as you get older because of the decline in your hormones. So if you'd like to schedule a consultation so I can answer all of your questions and we can get your blood drawn and take a look at where your labs are, just give me a call. If you have health insurance, this is covered by your insurance. If you do not, I have a very, very low cost option for you to make it highly affordable. So I look forward to meeting you.